Further to do things for social well-being. Community Action Networks, C.A.N. 2008. 5 priority areas for social welfare must apply in Pakistan at the grassroots level for the Pakistani society's welfare. Development and nurturing of our children, our youth, our families, our elders, ourselves. Basic needs: food, shelter, safety, mobility and essential health care for all. Affordability: jobs with livable wages, access to skill development, and a low cost of living, including low-priced housing. Equal access to health and human services, education, recreation, culture, civic participation. Appreciation for the richness of diversity. 2 areas of immediate application. C.A.N. 2008 suggests to focus on implementation of solutions in these 5 priority areas will first be concentrated on the areas of early education and care. Workforce development. Both areas above are very urgent needs for Pakistan to work on, so government must take action for these 2 areas urgently. See the action plan below for further guidance. C.A.N's Action Plan for Social Well-being. Community groups, such as those listed below, will use the following preliminary list of actions as a catalyst for developing and committing to their own action plan to improve social well-being, with emphasis in the 5 priority areas and 2 areas of immediate implementation. Individuals recognize and make the most of their own assets responsibly. Are they generous in their gifts of time and other resources for their neighbors and fellow citizens? Vote and participate in community and civic activities. Respect cultural differences and commonalities all people. Schools become neighborhood centers for a range of services and activities. Instill a lifetime love of learning. Engage youth in a meaningful learning experience that links academics to the world of work. Promote creativity, practicability, inventions and productions of all these locally, my emphasis. Employers adopt policies that promote a family-friendly workplace, including affordable access for workers and their families to health care, child care and development, ongoing skill development, and assistance of facilitation in gaining affordable housing. Develop partnerships with schools and job training programs to provide necessary skills and experiences for individuals to advance in the workforce and to meet employer needs. Give a great status to the teachers in the society, financially and securely, my emphasis. Public-private partnerships. Implement a coordinated, quality child development and care system. Develop a system to provide an affordable housing solution. Develop job training and literacy programs. Develop systems that remove barriers to access to basic health, human and mobility services. Adopt a social well-being impact policy for all actions taken. Governments adopt livable wage and corporate responsibility policies. Coordinate an emergency assistance program. Incorporate zoning and development codes, which encourage affordable housing, minimal transportation impact, and family-friendly, safe neighborhoods. Deploy a transportation system that assures access to services and jobs. Strengthen local government bodies at grassroots level, e.g. local councils, my emphasis. The faith community promotes volunteerism and advocacy on the social well-being agenda and areas of action. Coordinates individual ministries with areas of social well-being emphasis. Develop a financial stability program for religious service providers, e.g. imams, gurus, priests, etc., and help them to start and run own small business near their job places, so that they can enjoy basic necessities without indulging in extremist activities. Regulate their wages, pension, and health care and education benefits. Later make a regulation for their appointment by increasing education level for their appointments up to PhD, my emphasis. Service providers. Create a basic support system for families, screening all children at birth for the level of support which may be needed by family and connecting the family with appropriate services to provide that support. Create a community-wide case management system that uses common intake and eligibility information to meet individual and family needs. Consolidate service provider infrastructure, where possible, to reduce costs. Develop and deploy a coordinated, geographically accessible food pantry and supplemental nutrition program. Develop and implement a comprehensive emergency shelter and transitional housing system. Develop programs that reduce unsafe behaviors, particularly among youth. Media. Keep the community informed as to progress on social well-being goals and programs. Continue to promote social well-being outcomes and strategies to individuals and groups. Recognize employers with family-friendly workplaces. Educate media first about it and its importance, then enforce these on Pakistani media for communities' social well-being.